All right, good to be back on the show this morning with Dr. Barth, and definitely, say every Saturday from 8:30 to 9:30. We always stay here to tell you guys everything we guys do with health. And let me say last week or 2 weeks ago, we've been here of another Ebola outbreak. And I asked myself, I said, we never finished coronavirus.
Valentine Day.
Well, imagine on Val's Day. And now all of a sudden, Ebola is coming out again. I was like, no. We do not have the strength. We don't get the energy to deal with this. We are still trying to balance, and this is coming out. But thank God, doctor is here. And I think would they try sync the two this morning, talk about Ebola, of course, still talk about coronavirus, because the two of them are in the shell, and they are both important to be talked about. So, doctor is here. Doctor, we definitely missed you. Good to have you back.
Yeah, thank you very much. I'm happy to be back too. Good morning, Slimmy T.
Good morning, sir.
Yeah, thank you. And on that note, I want to say good morning to our viewers at home and around the world. Today we'll be looking at the emergence or resurgence, if you like, of Ebola virus. Okay, outbreaks in some parts of West African countries, specifically Guinea and DRC. Okay. Now, looking at the challenges that such an outbreak can pose in a pandemic era, it's actually it will be a Herculean task to a number of health facilities or health infrastructures in Africa that are already fast stretched by the ongoing active COVID pandemic. Okay. We can't afford to have another outbreak, another epidemic, at least not at this time. Okay, but we need to remind ourselves of the things we need to know, the important things we need to know that borders on prevention. Let's look at a little bit of history with respect to Ebola. We all know that Ebola virus was a virus that was first detected in the year 1976. As a matter of fact, there was an outbreak that was said to have occurred simultaneously in two countries of the world. One was in a place that is now called 1976, in the town called Inzara, that is now in South Sudan, as well as a town called Yambuku in DRC. That was the first time Ebola was heard of. It is today called Ebola virus disease, EVD for short, but it was formerly known as Ebola hemorrhagic fever. Okay? Now, the number of new developments with respect to Ebola virus. For instance, a vaccine has been developed for Ebola virus. And as we speak today, Guinea will be taking delivery of about almost 20,000 vaccines that will be arriving from Geneva as well as US. Now, and this vaccine, a lot of people can actually take those vaccines. Both the people, it can be taken prior in places where you have the pandemic, people who do not have it, healthcare workers, and then people who may be working in such an environment will need to take such vaccine to prevent them from picking up the disease. We'll talk more about that. But what do we need to know about this Ebola virus? Yes, it has been here before in Nigeria when we had the last outbreak. Of course, it also started in Guinea, and of course, it ravaged a number of countries in West African sub-region between 2004, 2013 to 2016. And of course, we know the Nigerian story, how it came to Nigeria through someone that visited. And this time around, we need to brace up ourselves. Okay? Now, some of the things why this virus is somehow difficult to diagnose is because the presentation is typical with a number of disease conditions that we have in this environment. Okay? Now, let me also tell us a little bit of the story of the Guinea outbreak. A nurse was said to have taken ill. And of course, initially, this nurse was diagnosed with typhoid fever. And after some time, when she wasn't responding to treatment, another doctor diagnosed her of acute severe malaria. While she was being treated, she also did not improve, and the nurse decided to seek help in alternative medicine. Okay, so she went to a traditional healing home where she came in contact with not just her family members, but also the traditional healer. And as we speak, I understand from the account that I read from Washington Post, I understand that five members of her family, including the traditional healer, have died of the Ebola disease as we speak. That tells us how contagious this disease can be. The average case fatality rate for EVD is actually said to be about 50%. But what we saw the last time we had the outbreak was between 25 to 90%. But the beauty of it is that the major difference between Ebola and COVID-19 is that people can only transmit the virus when they are manifesting the symptoms.
Okay.
In which case, there is nothing like asymptomatic carriers with respect to Ebola virus. Okay, but what we are saying is that this virus will actually hit us hard if it does progress or probably gets to Nigeria and a number of West African countries. Because as it stands now, our facilities, our healthcare facilities across the country have been overstretched beyond limit. And of course, we need to look at how it presents and how it can be transmitted from one person to the other. We do know that this is actually a zoonotic disease. Means that it was a disease that could be transmitted from animals to humans. Okay? Now, it came from fruit bats. Okay? And an individual, apart from being contracted from animals, from rodents, okay, it can also be transmitted from person to person through bodily fluids. And of course, this includes saliva, even sweat, semen, vaginal fluids, vomitors, and other effluents that could come from a sick person. In fact, the burdens of a sick person that may have been contaminated by this virus can actually be a needle of infection for some other people. I also understand that the nurse in question that died, that they actually didn't observe safe burial practices. And of course, that was how it has spread. Okay, so at the moment, they're trying to do a lot of contact tracing. And a number of people that attended the burial were actually said to have traveled back home in public transport. Oh. Okay, and this is a disease that has an incubation period of between 2 to 21 days. Okay, so emphasis will be made on surveillance, case management, infection prevention and control practices, of course, contact tracing and good laboratory care or testing facilities will be in the mix as well. I could remember when we had the Ebola outbreak, samples from Nigeria had to be sent all the way to a reference lab in Senegal for the test to be conducted. But that is not going to happen anymore because Nigeria has upgraded we have upgraded our facilities that we can conveniently, the number of labs in Nigeria that can conveniently test for Ebola as we speak. Okay, so we need to look at how this illness can be transmitted from one person to the other. And the danger sign there is that you never can tell who could be having it. And this is a disease that one can pick and travel from one part of the world to another. And of course, we know how itinerant our people could be. Okay, so there is no gainsaying the fact that it hasn't got into us. It's still in some West African countries. The possibility is that it can get here any moment from now. So we need to sensitize ourselves again. We need to remind ourselves again of some of the symptoms that when you see, you should have a high index of suspicion. Of course, you have fever. Fever is in the picture. You have fever.
I don't know. It must always
yeah, and when we talk about fever, we are talking about elevated body temperature.
High fever.
Yes, high grade fever when it goes beyond 38.5 degrees Celsius. Okay, so fever is there. The person could have cough. The person could have body pains, could have malaise, could have gastrointestinal symptoms like nausea, vomiting, and stooling. But the defining symptoms, why it got the name hemorrhagic, has to do with the fact that such people could have bleeding problems. They could be bleeding from several orifices in the body. They could bleed from the eyes, bleed from the nose, as well as some other parts of the body. And that is why it is called hemorrhagic fever. So it has to do with hemorrhage. Okay? So, but like I said at the beginning, the good thing is that we don't have the problem of having to battle with asymptomatic carriers, just like we have in COVID-19 when it comes to Ebola. Okay, so people who usually transmit the disease are people who are already showing symptoms. Okay, but I think 3 days before the emergence of symptoms, such people could still be very infectious. And it was on that note that Nigerian NCDC recently issued, I think that was on February 18th, a public health advisory following the declaration of Ebola virus disease outbreak in Guinea. And I want to read out what I have here briefly.
Okay, Doctor, I think before you read, I think it's important we go for this.
Okay, thank you very much.
So guys, we'll continue just immediately after the break. They say that when we join hands together, now when you do your hand like this, you do your hand like this, you do hand like this, now the hand is clean. If you wash hand like this, if you no clean. Wetin I dey tell you, that me say, if COVID got stop with you, it got stop with me. And the only way that thing fit stop, or where this virus fit stop, now if we all join us together to talk, say, we want to obey every measures, or we wear our face mask, no turn out to chin marks. I go wash my hand, whether person they watch, you know they watch me. I go make sure, say, when I dey come out, I get my sanitizer. I go make sure, say, even when I reach market, if I see, say, they clustered, I go tell them, may I give space. So that, you know, go reach you, you know, go reach me. Because the truth is, if you reach you, possibilities they say it go reach the other person with your hand. So as government they do their own, it go also make legit sense. May we all join body, do we own. Yes, we they try, but we can still do better. And the cocoa of the cocoa will be that. All right. So before we go for that break, obviously, we they do something new today. And why would they choose to do them this way now? Because say as the outbreak now don't share for West Africa, trust us, we are not spared. All right. If we go lose guard, if we come into Nigeria again, exactly. And because we do not want that now why Dr. Barth now don't carry the topic on say more join body, more collaborate the two together, talking about Ebola virus as it don't outbreak again for inside West Africa, and obviously coronavirus as they share around the world. So they don't talk so very much before we go on that break. But right now we go open the phone lines in as much as still you don't write plenty questions already on ground that will be asking the doctor based on coronavirus and of course in relationship with I beg your pardon, based on Ebola virus,
yeah,
in a relationship. The two of them I enjoy. So please call the numbers on your screen and of course turn down your TV volume as they try call us this morning. Now, first off, doctor, the first thing I write here, I don't know, are there possibilities of Ebola virus returning back to a body? Like talking about person who don't get them before. Like any possibility they say person who don't get Ebola before still get them again? Like does it leave, or once you have it, you're not careful, you get treated, possibilities are on ground that it could return?
Yeah, thank you very much for that very important question. I think that is another major difference between Ebola virus and COVID-19.
Okay.
We have seen plenty of people, cases have been reported of people who were previously infected, becoming infected again. As a matter of fact, recently I saw a colleague who once worked with us in our own facility. He caught the virus along the line some few months ago. And of course, after a while, he tested negative after undergoing treatment. Okay. But after some few months, he caught it again. And this time around, it was a lot more in terms of the symptoms, they were harder than what he noticed. Because I interacted with him, he said the initial time it was just malaise, it was just feeling of unwell generally, but the second time he caught it, it was a lot tougher. Okay, but that may not be the case. If we can look at what science is telling us with the case of Ebola, a lot of survivors, people who have survived from Ebola, have developed immunity that can last them for many years to decades. Okay, but however, there's also something I would like to point out. Some studies have actually shown that the virus still hibernates in some parts of the body.
That was what I wanted
or people who may have suffered from Ebola. Example, a number of survivors after many years, the virus was still noticed in their semen. Okay, so some of the body parts where the virus can hibernate for some time and escape the immune system of the body may include body parts like testes in the male, interior of the eyes, and of course, placenta. These sites have been mentioned that the virus could hibernate in those areas for a longer period of time after the person may have cleared the virus. So you can see there's a world of difference between COVID-19 and Ebola virus. But I also want to talk about vaccine, okay? Because, yes.
Yeah, but you know, Deomi is laughing. But because the truth is, I actually I penned down on that question on that, you know, because we are aware that we have vaccine. Dr. Barth, we are still waiting for a vaccine in Nigeria. Well, I'll just jump
because if you look at all these emerging diseases, emerging pandemic, we seem to have vaccine almost for all of them now.
Yeah, there is vaccine. I think there's vaccine for Ebola, right?
Yes, there is vaccine for Ebola.
So do we have drugs? Can it be treated?
We also have drugs, which of course I'm going to talk about shortly. There's vaccine for Ebola now that have even gotten FDA approval in the US. You know, when we went on break, I was listening to Professor Tomori from UI. Yes, debunking the claim that the COVID-19 vaccines are embedded with microchips that when people take, it can cause them to become infertile. They want to use it to wipe off the black population and all that. Okay, so we have seen an authority there debunking the claim. And also, recently, some few days ago, our own NAFDAC also gave emergency use authorization for AstraZeneca vaccine candidate. Suffice also to point out that this same vaccine candidate, South African authorities suspended
the same vaccine we want
the same vaccine, okay? But like I said, it probably has to do with the emergence of the South African strain variant, okay, which has been found out to be resistant to some of the newly made vaccines. Okay, so that's not to say we are sounding contradictory, because it is important we embrace science and of course embrace vaccines, because the only hope as it stands now for a number of these diseases are vaccine-based, okay? Guinea, for instance, are expecting the arrival of about 20,000 vaccines from Geneva as well as US.
For Ebola or for Corona?
For Ebola. And then there's also the possibility of having pre-exposure prophylaxis. The vaccines can be given to people who could be exposed. Okay, ahead of time. Okay, like healthcare workers, just like any other vaccine. Okay, so vaccine is central to some of these discussions that we're having now, and we need to embrace science. We need to do away with a number of disinformation and misinformation that are flying out there. Okay, and that's about that. Now, also to talk about the treatment, okay, but we haven't gotten to treatment.
Yeah, wait, Dr. Barth, because I remember back when the whole Ebola thing came up, he told us not to eat bush meat, run away from bush meat, don't eat anything that comes from the bush. I don't know.
Or poorly cooked meat.
Yes. So now, do we have to worry again about eating bush meat, poorly cooked food, or cooked meat?
The fact remains that some of the areas through which one can pick Ebola is when you have a break in your mucous membrane, in your skin, in the nose and around your limbs. Okay, now, this bush meat, you need to catch them. You need to do some cooking. You may come in contact with their body fluids in the process, even before you start cooking them. And of course, when they are not properly cooked, that could also become a danger. Even discarding or trying to discard dead rodents in and around our houses should be properly done. Okay, because if you come in contact with carcasses of dead animals that were probably infected with Ebola, you could also be infected. Don't forget, blood samples from even humans can infect others. Earlier in the discussion today, we talked about the fact that bodily fluids from humans, including semen, vomitors, sweat, saliva from an infected person, could also be a needle for infection for individuals around us. Okay? Now, yes, let me just mention it at this time because you've talked about it. There are two vaccines two FDA-approved vaccines now for Ebola. The first one is called imazeb, and then the second one is no. I'm talking about the drugs.
Okay.
The drugs. There are 2 FDA approved drugs. There's also approved vaccine for Ebola. 2 FDA approved drugs for Ebola. Imazeb is a combination of 3 monoclonal antibodies. Okay, is a form of drug, and the second one is Ebanga. The names are sounding African. I like that.
Yeah.
Ebanga. This one is 1 monoclonal antibody. These are 2 drugs that have been approved by FDA that could be used in the treatment of Ebola, and of course, they've given good results going by the studies that have been carried out with them. Okay. Also, there is a vaccine that is called Evebor. Okay, RVSV /ZEBOV, Evebor for short. Now, this is a vaccine that can be used today, and it must be one of the vaccines that are
tested and trusted,
that are being expected in Guinea, in Conakry. Okay, this weekend. Okay, so let's go back to the public health advisory that have been issued by our own Nigeria Center for Disease. Okay, NCDC. Public health advisory following declaration of Ebola virus disease outbreak in Guinea. Okay, the Nigerian Center for Disease Control, NCDC, is aware of the declaration of an Ebola virus EVD outbreak in Guinea on the 14th of February 2021. The cases and the deaths were reported among 7 people who attended the burial of a nurse on the 1st of February 2021. Following the declaration of the outbreak, the Guinea government has initiated response activities. The World Health Organization, WHO, African Centers for Disease Control, ACDC, and West African Health Organization, WAHO, have announced that they are supporting the country's response activities. The government of Guinea has begun processes to assess the global stockpile of vaccines for EVD from the Vaccine International Coordinating Group, ICG. The NCDC has an existing multi-sectoral national emerging viral hemorrhagic diseases working group, EVHDWG. This group coordinates preparedness efforts for EVD and other emerging viral hemorrhagic diseases. The EVHWG has carried out a risk assessment of the possibility of transmission of the virus to Nigeria. Given the proximity of Guinea to Nigeria and other West African countries, as well as other indicators, Nigeria has been placed at moderate risk of an EVD outbreak.
Hey.
Now, let me talk about risk. It could be categorized in 3 ways. Okay. The risk could be mild, it could be moderate, and of course, it could be severe or heavy. Okay, so when we say moderate, it has gone beyond mild. Okay, so we need to be careful. The output from these risk assessments are being used to initiate preparedness activities in the country. Several measures have been put in place to prevent and mitigate the impact of a potential EVD outbreak in Nigeria.
You don't want that now.
The National Emergency Operations Center, EOC, operating from NCDC's Incident Coordination Center, ICC, is on alert mode. I'm happy to hear that we are very much prepared.
Right?
Yes. Using all the lessons we learned the last time we had
Doctor, would you say
epidemic.
Would you say we were lucky the last time we had it? Because
we rose to the challenge. It wasn't luck that did it for us. Kudos to Nigeria. We are still receiving...
If we could rise down much for Ebola, why is it a big deal for us to, I don't know, because, I was telling you why they were doing that, because I was telling you something. I said, I don't know, recent I've been happy because every day I try to monitor the numbers, and I found out that for a couple of, I don't know, days now, or should I say a week now, we've had decrease in numbers. Like, I think there was a time that we didn't even have any case recorded in Lagos. Yes, I think sometimes last week, and the governor was extremely happy. For yesterday, I think we had 600 and something, it wasn't up to 1,000. So now the numbers are decreasing. Are we doing something good?
I want to look at it from another angle.
Okay.
The day you talked about that Lagos didn't record any case, no. I think what should be rightly said is that Lagos didn't report any case for that day because the next day they reported due to some.
So should we say there was no test carried on that day?
No, they did. They carried out
So
a number of
happened?
tests. So occasionally they may not report a case due to challenges in coordination and collation of results. That can happen.
So it wasn't like there was
no.
But then the numbers are decreasing.
Should we celebrate because the numbers are decreasing? I think my answer is no. Okay, the numbers may be the decrease in the numbers that we are seeing could be related to a number of things. It could mean that probably it was weekend and then we didn't test as much as we were doing during the weekdays. It could be that some states are not testing as much as they should be doing. I read recently that
means we are slacking.
That one of the states in the south had to rejoin the testing, testing of their people. That the test centers were destroyed during the last NSAS disturbances or protests. Okay, but they've been able to rejoin the NCDC testing protocol. Okay, so there may be a number of factors. It couldn't just mean that we are winning. Yes, we are making good efforts to win the battle. We also want to see victory, okay, on all fronts. But it's not yet time to celebrate.
Okay, fine.
And then I'm just concluding here. Several measures have been put in place to prevent and mitigate the impact of a potential EVD outbreak in Nigeria. A National Emergency Operations Center, EOC, operating from NCDC Incident Coordination Center, is on alert mode. We have a team of first responders on standby, ready to be deployed within 24 hours in the event of an EVD outbreak in Nigeria. We also have established testing capacity for EVD at the NCDC National Reference Laboratory. The NCDC will continue working with states to strengthen our preparedness activities and so on and so. So I'm happy to announce that, yes, we are prepared. Just in case it gets to Nigeria. But at our level as individuals, what should we do? What is needed of us is that we should have a high index of suspicion. If you see somebody around you having some strange symptoms like bleeding from the mouth and nose, you should be careful.
Fever.
Yes, you should be careful. What we should do is not to rush
another break
to give such a person a helping hand. You should protect yourself.
Should you come to the NCDC? No.
We'll come back.
All right, so guys, let's go for another quick break and we'll be right back. We don't talk for words. We don't talk with videos. So there's no way you will tell us that you be no get the informate. We don't pass on top coronavirus. Don't give me the measures. We don't tell now waiting our guys do to stay alive for another day. All right. Doctor, before we go on that break, we did talk so much. Yes, today is more like our attention is so very key on Ebola virus. So I want to ask you, because there was something I wrote down before. I don't know if you still have time to answer that. For coronavirus, tell us your door knobs, your car knobs, your this knob, no, sanitize, wash your hands and all of that. So really, is that applicable to Ebola virus? And secondly, for Ebola virus, can we have home management? Yes, now can we have home management for Ebola virus? Because like coronavirus, if it's not severe, you can like treat at home and stuff. So for Ebola virus, can it also be managed?
Can it also be applicable?
And the last one, because of my time. Now, do we have isolation centers ready for Ebola virus? So I'm asking, may you understand the fact say our isolation centers now for coronavirus are filled up. The ones that are not filled up are shut down. Now we are talking about another thing. So now, do you feel, do we have enough isolation centers, or do we even have isolation centers at all for Ebola virus?
Thank you very much. Let me start in the order you asked your questions.
Okay.
Number one has to do with can the virus survive on hard surfaces? Doorknobs, can knobs, tabletops. The answer is yes, for several hours. Okay, so the Ebola virus, the Zaire strain, is actually the one that has been responsible for most of the large outbreaks that we have had in the world. Okay, so the virus can survive on doorknobs, tabletops, and a number of other hard surfaces for several hours. Okay, so a hospital-grade disinfectant solution will have to be used to clean those places as much as we do for COVID-19. Okay, from time to time. In my own facility, I instituted what I would call a measure. Okay, so our doorknobs are cleaned every 2 hours with soap and water. Okay, so that is to ensure that as people are coming in, patient traffic,
touching it,
yes, and sanitizers are distributed not just at the entrance, in a number of places. So you could actually take from wherever you're sitting or staying in the hospital. Why is this so? Because of the high cases of COVID-19 that we've been seeing in a number of hospitals. Okay, I have seen in the last 1 month, I've seen more than 5 cases. Okay, so it's not like they are there or they are there. Yes, COVID-19 can be managed at home if the symptoms are mild, but those ones that are presenting with symptoms, moderate to severe cases, cannot be managed at home. Does it also apply? Can it be applicable to Ebola virus? The answer is no. Why? Because the case fatality rate, the average case fatality rate for Ebola is said to be at 50%, and it could be as high as 90% even. Okay, so people who have Ebola, they come out with severe symptoms. Okay, unlike what we have. Okay, so because their symptoms are usually severe, there is no such thing like as home management. So that cannot happen with respect to Ebola.
Okay.
Do we have isolation centers ready for Ebola patients? Should we have that in Nigeria? I honestly do not have an answer for that. I must be very honest.
I thought you said we were ready.
Yes, NCDC said so.
Okay.
Not Dr. Barth.
Okay.
Okay, because I do know the number of isolation centers have been shut. Okay, we may have to reopen them. Can the COVID patients be managed alongside the Ebola patients? My answer was, of course, with medical knowledge, the answer should be no.
So that means they have to have different isolation centers.
Yes, there may be needs to have different isolation centers, because someone who infected with COVID could also be infected with Ebola in the process if they come so close to one another. So the reverse can also be true. So they will need to have a different isolation centers. As it is presently done in Guinea, they're battling 4 different pandemics now. They're battling measles epidemic, 4 different epidemic outbreaks, not pandemics. COVID is there, measles is there, I think cholera and yellow fever are another one. Okay, so a number of African countries are overstretched in terms of our health infrastructure, and that is why prevention
is the key word. That is the take home.
Yes.
Prevention, trust us, that is the key word right now, because you wouldn't want to come down with any of these two.
And it's on that note that will be drawing the curtains for today's presentation. Do not lose your guard.
Ebola is knocking. Ebola is knocking. Corona is real.
Yes.
So please do all you can to stay safe. I know say party day this weekend. You guys will be turning up. Please do all you can to stay safe. Go with your... You can see Dr. Ba, he doesn't joke with it. All right, that's now why the social distancing day between us, all right? We have our own sanitizer. They are everywhere in WAP TV. We get our... You enter, they wash your hand, your masks, and obviously they will check your temperature from our gate. So we are doing everything possible from our end.
And that should be the standard.
Yeah, the standard for everyone.
Places.
Yeah. Love you guys.